Whenever I was 10 years old, I wrote a paper saying why I want to be a neurologist. Not just a doctor, but a neurologist. And it's a little bit funny, no one else in my family is a physician, but my mom is a nurse and she worked for a neurologist at the time. And so the bus used to drop me off at their office after school for a little bit of time until my mom was done working. And so he became a good mentor to me, and I wrote a lot of papers as a young little nerd about the brain, and it kind of just grew into a joke of my parents saying, "Oh, our son wants to be a neurologist at 10 years old," and here I am. Most of the patients that I see, especially in the office setting, are patients that have either had a recent stroke, and I'm following them up from a hospital discharge and making sure that they're on the right track. Or we see a lot of patients who come in and they want a second opinion for a stroke that they may have had somewhere else or sometime either in the recent past or remote past that they feel they just don't have a good grasp on, and so they want a second opinion from us. And so typically someone will come in and be triaged by one of our nurses and kind of go through their history and give us some information so that we know walking in what we're getting into. And then also that gives us a little bit of chance while the nurse is doing the intake to go ahead and review some of their images if we haven't seen them before. The more information that I have up front for these patients, the easier it is for me to give them some of the answers that they're looking for by the end of the appointment. Sometimes it's just communicating maybe something that hasn't been communicated about what's been done in the past and why it's been done. And I think that some people get some satisfaction to knowing exactly why they're taking the medications they're taking, why they may have had a stroke, what their risk of stroke going forward looks like. So I pride myself on being a local kid. I grew up in Canton, Ohio, but I'm a big Cleveland sports fan. So unfortunately, sometimes, most of the time, but I love anything Cleveland. I like getting outside. I'm very active outdoors. I like working out. I love spending time with my friends and family who luckily are still in the area. So anytime that I can get downtown or enjoy something new about Cleveland, I'm out there doing it.